Therapists should be asking their clients before they come in whether they've got a cough or a cold, and they certainly shouldn't come in if they've got that. They should ask them if they've come off a plane in the last 14 days, because if that's the case, they should be in isolation. And they should ask them whether they've come in contact with anybody who they know has had COVID-19. Those are the screening questions you need to ask. And of course, you should do it in a positive way, but the fact is you've got to eliminate those clients from your practice to protect yourselves and to protect subsequent clients coming into your room. The core of protection is hand washing with soap and water, and doing it for at least 20 seconds and doing it really thoroughly between your fingers up into your wrists and so on. So really long hand washing with soap and water. And soap destroys the virus because the virus is surrounded in fat, and soap breaks down that fat, and it also breaks down the fat layer on your skin where the virus lives. So soap and water is critical, and for about 20 seconds. Hand sanitizer with a high alcohol content, that's 60 or 70% alcohol, is okay. That will kill the virus, but hand washing with soap is really critical. Whether you wear gloves, I suspect, is neither here nor there, because you can still infect yourself. You can touch somebody, then touch your face with those gloves, and the gloves have been a waste of time. I think it's really the fact that you wash your hands religiously and try and minimize the number of high-risk people that are coming into your waiting room. I think surgical masks make sense for any healthcare worker, including massage therapists, because it is close quarter work and you don't want to pick up droplets from somebody, anybody really, but you certainly don't want to pick it up from somebody who might be carrying COVID-19 and you don't know it. So that would be a sensible precaution. You need to be obsessive compulsive about your waiting area. You should try and organize your appointments so there's no more than one person in your waiting area at any one time. That's a bit hard if there's 3 or 4 therapists working at one time. But there needs to be at least 1.5 meters between people. You should remove magazines and things like that people are going to touch and pass around. And then you should have your receptionist regularly clean the furniture with alcohol wipes so that any germs on them, any virus, is actually killed between times. You're just going to have to be obsessive compulsive about surfaces immediately after somebody's used them. Massage therapists are probably at increased risk from the use of massage oils, because massage oils, being fat, could absorb the virus and then pass them to your hands. But again, if you're not putting it onto your face, you're okay, and you're wearing a face mask, so if it splashes, you're not inhaling it, then that's a good thing. But it doesn't provide you with any protection. So nobody really knows the answer to that question, so you just got to be really careful and obsessive compulsive.